Dental implants fail for really a number of reasons. Systemic conditions, medical conditions the patient could have or not know that they have. And that's why we do a medical questionnaire and go through and put checks in those boxes. Habits, of course, smoking, alcohol can have an effect on it as well. On the doctor end, we can have bite issues where the bite wasn't properly ground in. Also, how the implants were placed, where they were placed are all factors. With a potentially failing or ailing implant, what we want to do is, how much bone loss is there? What can we trace what the causative factor is? Does the implant really need to be removed? Or could we go in, clean things up a little bit, potentially bone graft around it? There are different options that we can explore. A lot of times patients won't be able to tell if an implant is failing or ailing. That's why at Smile 360, we really run a strict maintenance protocol, having our patients come back in for arch inspection. If a patient chose a snap-on denture on 2 or 4 implants and wanted to make the change and go to a fixed screw-retained full arch zirconia prosthesis, then we take our CT scan, identify available bone, where we can potentially place 1, 2, 3 more implants and move forward in that fashion. When we initially place a patient's first set of teeth, it's in either a 3D printed material or could even be in what we call a PMMA, which is a little bit more durable material. The bite has to be thoroughly checked and adjusted because it can put undue force or stress on an implant or implants and leading to potential failure. At Smile 360, we've established a relationship, and that doesn't end when their final product goes in their mouth. If you're curious about dental implants, we do offer free consultations and a free CT scan where I'm going to sit down with you. We're going to go over the options, and I know that you'll be happy with your outcome.